Another question, another key question. What about first adulthood? What about after Risser free? There is a consensus that after Risser free, braces are not useful. But here in Lyon, Stagnerà, in Milano, Sibilla, used it with good results. And starting from then, since many years, we propose bracing in young adults with two main aims, aesthetics and curve reduction in worst cases who do not want to be operated. We tell them we can achieve a good aesthetic. Let's try to see what happens with your COP degrees. If we reduce the COP degrees, this is useful for your adulthood. Do you want to try? If the answer is yes, we go on. So, what happens to young adults, Risser 4, 5, up to 20 years of age? Again, the same design. The inclusion criteria were Risser test 4 to 5, age up to 20 years, independently of the COP degrees. We had two groups, the one treated for aesthetic reason under 30 degrees, under the green line, those treated for to try to improve the curves over 30 degrees, and the age, you can see the age, they are quite old, the braces. We had 23 patients in the aesthetic group and 13 in the COB, the COB group, that is the curve reduction group. Social criteria and outcomes and statistics. Treatment lasted much less in the aesthetic group. In 2 years, you can obtain what you want to obtain aesthetically. While in the COP degree groups, it takes almost 4 years of treatment. We don't have the compliance rate of all the population. I'm sorry for that. But the compliance rate, again, was not statistically significant among the two groups, but very high again. We had one patient that remained over 45 degrees at the end of treatment and no patient fused. Here are the results, statistically significant in favor of the COP degree groups in terms of COP degree. We had one patient progressed in the aesthetic group. Progressed in terms of COP degrees, not in terms of aesthetics. Elia, Risser 4, these are the final results. And again, the presentation of the COP degrees of Elia and the aesthetics. Trace. Usually it is reported progression in adults after discontinuation of brace. Improvement has been reported by the spinal cord group after discontinuation of brace. And this is interesting. We found only some case reports about treatment in young adult patients. One case report on bracing Risser 4 with good result, published in Les Annales de l'Éducation in France, and some case reports on manual therapy and door exercises. So there are no studies in this field. But if we have improvements, what do we do with bracing? After Risser 4, if there is some growth, residual growth, it is a question of 1 centimeter. We all know that the body, the vertebral body, is the last one finishing to grow. So that centimeter is up to the trunk. And so there is still some more growth. But I don't think that reduction, as you have seen in the case of Elia, 20 degrees reduction can be considered coming from growth. There are other things such as posture, movement correction, soft tissue remodeling. We have to remember that ligaments and bone, ligament finishes to, how can I say, not strengthen, it is shorten in the first adulthood, up to 25 years. It is the same for the bone mass. We continue to increase the bone mass up to 25 years of age. I really don't have any solution. I'm just showing you the results. But this can question what we usually do. We have results, we can have results also in young adults. Anyway, in these cases, we always ask to the patient, and it is a joint decision between the patient and the physician. Strengths and limits are exactly the similar to both previously reported, even this is the first study focused on this age. It's not possible to say how many failure, all those things. This is only a retrospective study. Let's wait a couple of years to have the prospective studies. But at this stage we can say it is possible to treat young adults with good results. This raises questions about braces' way of action. The aim of treatment should be well defined and understood by the patient before starting such a difficult treatment lasting 4.5 years in young adults. And now I'm ready for discussion.